Back to an introduction to recovery residences. This video will answer the question, why now? While recovery residences have been in existence since at least the mid 1800s, numerous factors are driving for greater interest today. Probably the biggest thing, the biggest driver is consider the fact that most with substance use issues return from treatment or institutions to living environments that enable addictive lifestyles. The current system is simply setting individuals up for failure. I think we also need to look at this growing shift away from the acute care model towards a chronic care approach. And we can take a look at that from the perspective of recovery systems of care, the Parity Act, the growing use of recovery support services, and really what is driving insurance interests. So first of all, let's take a look at some data. Despite addiction being a chronic illness, the U.S. health system has historically treated it with acute episodic services. More recently, there's been a shift towards a chronic care approach that includes a continuum of care, including recovery housing. A study conducted by NIDA determined that 30-day treatment centers were approximately 30 to 35% successful in treating addictions. The same study found that if clients transitioned from residential care into some form of aftercare for 6 months or longer, that success rate increased to 65 to 70%. So we're talking about recovery housing here, or at least that is an example of where individuals are going, after residential treatment and why there's this piqued interest in recovery housing. So the concept of a recovery-oriented system of care, or ROSC, it's a comprehensive chronic care approach to mental health and substance use recovery, which was promoted by SAMHSA, which stands for the Substance Abuse and Mental Health Services Administration. Through widespread input, SAMHSA drafted a definition of recovery, which includes 4 supportive domains: health, home, purpose, and community. In a later video, we're going to do a much deeper dive around this, but know for now that recovery housing supports all 4 of these domains, and in turn, recovery housing should be considered a vital resource within each and every recovery-oriented system of care. The next topic to review is the Mental Health Parity and Addictions Equity Act of 2008. You may have heard it as Parity. So this was federal legislation that required insurance companies to offer mental health and substance use benefits equal to major medical, with a couple of exceptions. This means that insurance companies are now faced with covering multiple addiction treatment exposures. At one time, insurance companies could give you, one 28-day trip to addiction treatment, and then after that, say that you've used up your benefits. But now, as a result, third-party payers are beginning to look at more cost-effective approaches in order to minimize their risk. Next is looking at recovery supports, which are greater valued. A growing body of research and interest around recovery support services, which include recovery housing, as a cost-effective means of increasing recovery outcomes. Research around recovery housing has showed that there's an improvement in abstinence rates, improvement in mental health, increased income and employment, as well as a decrease in criminal justice involvement. So these are all recovery outcomes, real outcomes that third-party payers would be interested in. And speaking of third-party payers, there is insurance companies that are interested in lowering costs and increasing outcomes. These insurance companies are increasingly exploring housing as healthcare, and recovery housing is a part of the reimbursable continuum of care. So another reason of answering why now is the shift from public safety to public health. And we're going to cover justice reform, the opiate crisis, as well as community-based services. Let me get to my notes real quick. So addiction has long been viewed as a public safety issue, but there's a growing shift to view it as a public health issue. There are several things that are driving this shift. One is criminal justice reform. Overcrowding of jails and prisons with people with substance use issues is a challenge. All you have to do is Google the cost of a jail bed day in your local or state area to see that diverting individuals who are engaged in the criminal justice system as a result of or who have substance use disorder, we should be connecting them with recovery oriented services. This makes economic sense. Not only maybe is it the moral and right thing to do from a health standpoint, but it makes economic sense as well. Then, of course, there's what's really driving a lot of decisions today is the opiate crisis and a wider recognition of harm reduction strategies such as medication assisted treatment and the use of naloxone, and which is a medication used to temporarily reverse an overdose and get people into emergency care. So from 1999 to 2010, opiate prescriptions quadrupled in the US, and deaths from prescription opioids correspondingly quadrupled. A record 42,000 people died of an opiate overdose in 2016, of which 40% involved a prescription opiate. The average cost of a hospital admission for an opiate overdose increased from $58,500 to $92,400 between 2009 and 2015. This far outpaces medical inflation and is attributed to opiate overdose patients are arriving in worse shape, maybe sicker, requiring longer stays and higher level of treatment. So again, it's not only the right thing to do, but it could be the most cost-effective thing to do is getting people into the public health system rather than the public safety system. And the final thing is looking at community-based services. There's an increased focus on home and community-based services. Recovery occurs in the community and not in institutions. Again, moving out of that public safety infrastructure and into one of public health. So another reason answering, why now is preventing and ending homelessness. Safe and stable housing is one of the 4 pillars of recovery support. This is according to SAMHSA. But there is a shortage of affordable housing. This contributes to homelessness. People with mental health and substance use issues can be particularly vulnerable when it comes to homelessness or being precariously housed. And approximately 1 in 5 people experiencing homelessness have a chronic substance use disorder. Studies have found that leaving a person to remain chronically homeless costs the taxpayers as much as $30,000 to $50,000 per year. This is compared to $20,000 per year to provide them with supportive housing. And depending on the level of support that's required, they could access recovery housing for maybe as low as $9,000 per year. So again, it makes economic sense to get individuals that have experienced homelessness connected in with housing. While HUD has identified recovery housing as an important option for persons who choose an abstinence pathway to recovery, funding policies favor Housing First, which is a permanent supportive housing model. And Housing First, these are living environments that do not require abstinence. And as such, they may not be a safe or stabilizing place for individuals with substance use issues or for families with children. While Housing First models have been proven effective in promoting housing retention, especially among individuals with primary diagnosis of mental illness, evidence suggests that evidence to support positive outcomes related to people with primary or co-occurring substance use disorder are mixed, and I would even say perhaps questionable. So it really requires us to advocate for recovery housing as a vital part of housing choice for individuals. So a supportive housing approach like Housing First, permanent supportive housing, its focus is it's a harm reduction approach, and its thought is by you can increase recovery and wellness through housing stability. That's the name Housing First. If you get someone housed first, then you're going to be able to increase their recovery and wellness. And again, that might be true for a lot of individuals. But a recovery approach, as opposed to a harm reduction approach, would look at, so can we increase housing stability by getting individuals connected with recovery and wellness. And that is the approach that recovery residences or recovery housing uses. So if we believe that there are many pathways to recovery and that recovery is a person-centered process, then why wouldn't we support someone's choice in living in sober, safe, peer supportive living environment like a recovery residence? This could be part of their abstinence pathway. Funding policies must promote choice, including recovery housing. And so I want to highlight that because it's not a one or another. It's really about creating that continuum of care that includes funding and making available recovery housing. So not only in theory, but actually, in the continuum of care, we need to make sure that there are policies and funding policies that make sure that if individuals want to choose recovery housing, that we can get them access to that recovery housing. Another reason, why now is this growing body of research in academic literature. The research reveals that recovery housing increases abstinence, it increases employment, it increases monthly income, it's improving psychiatric systems, and it decreases arrest and recidivism. And there seems to be a tipping point at 6 months. And so, what should we be doing to encourage individuals to be accessing recovery housing and staying connected with that recovery housing for 6 months or longer? So, in answering the question, why now, I think it's important for us to take a look at new turning points in federal policy, because there's been quite a few. So one is the importance of housing choice for persons with substance use disorder was acknowledged at a public policy meeting. This was hosted by the National Council for Behavioral Health and for the Corporation of Supportive Housing. They brought thought leaders from the harm reduction world, from permanent supportive housing and housing first world, from the recovery world and recovery housing world, all to talk about how do we support individuals who have been who've been unstably housed or experience chronic homelessness if they have a substance use issue. And so that was huge because that dialogue had not been happening before. Shortly after that, we saw that HUD released a policy brief on recovery housing and acknowledged that recovery housing is a vital choice within the housing continuum for persons with substance use issues. That was in 2015. In 2016, we saw that the USDA started making some of their programs available to recovery housing. The USDA Community Facilities program was offered itself to what they called alcohol and drug-free transitional housing. And this was partially stemmed from the Obama administration charging the Department of Agriculture with addressing the opiate epidemic in rural America. And so we start seeing other agencies. Typically, we think of Health and Human Services or the Substance Abuse and Mental Health Services Administration as those federal partners that are stepping in and working with recovery residences. But for various reasons, including the opiate epidemic, we're seeing other agencies like the Department of Agriculture, like HUD, and we should likely see, other agencies as well take an interest in recovery housing. So again, in 2016, we see the Comprehensive Addiction Recovery Act, or CARA, being passed. This was historic. Never before had a bill passed at the federal level that really addressed addiction recovery the way that this did. Section 302 was called Building Communities for Recovery, and it authorized the Secretary of Health and Human Services to award grants to recovery organizations to develop, expand, and enhance recovery support services. Again, this is to this level had never been done before. The funds may be used to develop, expand, or enhance statewide recovery support services, and $1 million for each of the fiscal years from 2017 to 2021. So, definitely funded and is elevating the use of recovery support services in federal legislation. The momentum was building in 2016 because we saw the Surgeon General release their very first report on alcohol and drugs and health in the United States. It's called Facing Addiction. It's a really comprehensive. I encourage you to take a look at this document. It's very comprehensive, and Chapter 5 is dedicated to recovery, the many paths to wellness. And within Chapter 5, there are several sections that highlight recovery housing. And this is the first time that I ever saw recovery housing elevated to this level at the federal government. So again, this is a huge resource, and it shows how this national dialogue was building in the early 2000s. That momentum kept on building. We saw a congressional forum on recovery housing in 2017. The BRASS tax, which stands for Bring Recovery Support Services to Scale, Technical Assistance Center Services, which is a program within SAMHSA. They had an expert panel on recovery housing and also held summits in 2017. Under the Trump administration, there was a White House Commission on Combating Drug Addiction and the Opiate Crisis. They released their report in 2017, and there was at least 5 policy recommendations specific to recovery housing coming out of that report. And there was a recovery housing issue brief that was developed and released in collaboration between the National Council on Behavioral Health as well as the National Alliance for Recovery Residences. So you can see, when it comes to why now, there is this growing momentum and dialogue on the national level. We can't skip this topic without pointing to the fact that, although everything that we've talked about before has been very positive, there have been some kind of negative influences that has put a spotlight on recovery housing. And I'm talking about the unethical and illegal business practices that we're seeing in headlines. We've seen a record number of indictments, and states are starting to issue legislative solutions. So recovery housing providers, recovery residence providers have been engaged in these practices, sometimes unknowingly, but engaged in patient brokering, kickbacks, the use of inducements, the exploitation of individuals and financial benefits, as well as discrimination. And so I'm not saying all recovery housing providers, but there have definitely been some bad players that have been brought into to this area. And so that has created, a lot of attention on this topic and is an answer to why recovery residences now. So that ends this particular video. We're going to talk about how the momentum is continuing to build and look at things in the future.